Now we'll look at BPH. So BPH is what is known as the benign prostatic hyperplasia. So once you know the terminologies, BPH will not be an issue to you. Of course, once you say something is benign in medicine, it shows you that that thing is calm. It's not a cancer that is spreading to other places. Okay. Then, of course, when you're talking about hyperplasia, okay, if you are talking about, sorry, I'm coming. If you are talking about hyperplasia, there's increase in the number of cells. Yes, increase in the number of cells. So the cells are becoming crowded in a place. So this is just a prostate issue, and of course, prostate is only found in the males. So you have this issue only in the males. So benign prostatic hyperplasia, or you say that is a common condition and usually affects what men that are older. So the prostate is getting enlarged, but it's not cancerous. Okay, it's different from prostate cancer. Okay, so it can get so enlarged and basically is blocking your urine from coming out. Okay, so nature is non-cancerous enlargement of the prostate gland. It's linked to aging and hormonal changes. Do you understand? So mostly it's affecting men that are over 50 years. And if you survive from it, at least from 80 years, you have this issue. Okay? As I'm talking, I'm just actually praying that it shouldn't happen to me. Benign prostatic hyperplasia. So basically, the issue that this man is facing is for urine to drop from the bladder down through the urethra, down through the penis. There's an issue because there's what? A constriction here. Okay? So that's it. So what are the symptoms? The person always is going to urinate. Why? Because even when they go to urinate, they don't empty the bladder. So as they come back, they feel like to go and urinate again. Okay? Then difficulties in starting urination. You go to urinate, but for the urine to start coming out, there's issues. It's wasting time. Weak urine stream. Observe your fathers at home. It could be that they go to urinate and they waste a lot of time. They have BPH. Okay. So weak stream urine. Your urine is coming out and you can't actually shoot your urine like where you were small. Feeling of incomplete emptying. So you just urinated but you just feel like there's still something left. But if you try it doesn't come out. You know. Urgency or dribbling. So it can also lead to now the person is not keeping urinary tract hygiene urology hygiene, and they will now be having urinary tract infections, bladder stones, kidney damage, acute urinary retention. Okay, so you diagnose this by the symptoms. The person is complaining, and you are basically what hearing they complaining about these things. They mustn't pronounce it like this. They say that doctor, if I go to urinate, the thing they take before it come out. You know that there's difficulties in starting urination, that's hesitant. Patients will not know these words. They say that doctor, anytime I dey sleep for night, I dey always wake up for night to go sleep, like to go piss. Now you ask them how many times, they can tell you five, 8 times. That's what? Nocturia. So that's it. So physical examination where you do rectal examination to feel the back of the prostate through the anus. PSA, that's prostate specific antigens, ultrasound, and urine flow studies. So treatments include lifestyle, you know. So when it's evening time, they have to reduce the amount of urine amount of fluid they are taking to reduce the amount of urine they will produce later. They should limit caffeine and alcohol. That's why I don't take alcohol. I take water. So medications include alpha blockers. They relax the prostate muscles. And then five alpha reductase inhibitors. They also shrink the prostate. Okay. So also they also do all those transurethral microwave therapies, laser therapies, also the transurethral resection of the prostate for severe cases.